Thank you. And how appropriate it is that as we begin to wrap up this two-day event, we get to the point now of the bottom of the food chain of how research results are disseminated to the general public, to patients, to news consumers, to healthcare consumers. And that's the world in which I live. And so with my 10 minutes, or you're going to give me 15, I'm going to give you a little bit of background about our work, because I think most of you aren't familiar with it, although I'm delighted to hear from a number of you how you are already followers. So this is a site that I have now worked on for nearly 10 years that is one of a kind in this country. We do systematic reviews of news stories and of now healthcare news releases that include a claim of efficacy or safety about an intervention. So a treatment, test, product, procedure. If it's a story that makes a claim, lets researchers get away with a claim about an intervention, it's eligible for review. We've only begun doing the news release reviews since April. We, as of today, I think have 86. We'll hit 100 by the end of the year. And then outside this somewhat rigid review of the systematic criteria-driven story and news release reviews, we have a blog, which in the nature of most blogs is a bit edgier, more opinionated. We bring many more voices into it. As an action point, I open this up to all of you. I would like to include many of your voices on our blog, where we touch on broader topics of media messages, including advertising, marketing, and journal policies, and of course, journal news releases, all of which feed into this tsunami that washes over the American public every day. We are the only systematic review and feedback mechanism for media messages in the US. The feedback mechanism part of this is if Brian reports a story and we review it, we send Brian an email and a link saying, "You've been reviewed, buddy, look it up." And we have seen positive results from this. It's very important that I recognize the pioneering work of the Australian media doctor effort that was launched largely on the back of David Henry, who was then at the University of Newcastle, now in Toronto, and allowed us, I remember the conversation we had 10 years ago, David, where you allowed us to adapt your 10 criteria. But whereas there were once 6 such global efforts, there was Australia, US, Canada, Hong Kong, Japan, Germany. Now only ours and Germany are left standing. I almost went over a cliff, but that's where the Arnold Foundation came in. I went 19 months without funding and was ready to hang it up when Stuart came to me. So again, this is what we do, reviewing healthcare media messages that include claims across the whole range of different types of media formats and messages. This is a little bit about how we do it. There's only 20 of our 45 faces of contributors here. It's not just me. We always have 3 reviewers per review applying 10 standardized criteria, which you'll see in a minute. And the breakdown that you can see there of our contributors, a lot of docs, a lot of PhDs, a lot of journalists, some communication scholars, some public information officers, the type of people who write news releases, and then 3 women who came to us from Annette's wonderful project lead training. Didn't hurt that one of them also has her PhD in epi. So when we get especially a breast cancer story, we're likely to involve one of those 3 women as one of the reviewers. So here are the 10 criteria. Remember, so it's a story that makes a claim about an intervention. So if it's talking about how wonderful usually something is, does it address cost? Does it adequately quantify harms and benefits? Relative risk reduction, for example, is not good enough. That's not adequate. Does it independently evaluate the quality of the evidence, or does it treat a phase 1 drug trial as if it's the same thing as the conclusion of a 3-year, 3,000-person randomized clinical trial? Does it, in discussing the new, discuss alternative options that by definition have a longer, more proven track record? Does it avoid disease mongering, which is wide-ranging? Does it establish the novelty of the idea, or is this really old fish in new wrapping? Does it establish the availability of the approach? Again, does it make a phase 1 drug trial sound like it's available today at your corner drugstore? Does it include an independent perspective, and does it look at conflicts of interest in the sources? And here's the report card in a nutshell. After 2,100 story reviews, the 5 worst are the 5 top, and it shows you that between 60 to 70% of these 2,100 stories by leading news organizations in the US just simply don't deliver. So for those of you that are clinicians, what kind of this pattern of media messages in the hands of your patients, what does that do to the informed decision-making encounter, the shared decision-making encounter? What does it do with how you use your clinical time, having to waste it, frankly, often, debugging the hype that is delivered in many of these messages? I think not only about what it does to the physician-patient encounter, but what it does to individual decision-making back home, what it does to the public dialogue, what it does to the voter going into the booth next to me who is likely to oppose any candidate who says anything about comparative effectiveness research because they have been trained through media framing to look on that as rationing, not rational. So these are some of the common themes that we've seen, and by the way, I do have a poster. It's the first one you see when you come in the door on the far right, and pinned to the poster board are a couple of articles that go into this in far more detail. So I don't really need to go beyond the big one in bigger font over and over and over again. Media does, but science does, conveys a certainty that simply doesn't exist. And what are we doing to the public dialogue? We exaggerate effect size. We use causal language over and over again to describe observational studies. And so we create like Linda Blair's from The Exorcist with their heads spinning around, trying to catch up. What do we mean about causal statements about observational studies? Victor Montori and John Yudkin, I believe, coined this phrase, idolatry of the surrogate, where stories, media messages fail to explain, but researchers fail to explain the limitations of surrogate markers and endpoints. The tyranny of the anecdote. We're really good at telling the success stories, but we rarely profile in our stories the dropouts, the dissatisfied, those who chose a conservative route rather than aggressive route, those who chose active surveillance or a lifestyle change. Single source stories with no independent perspective. That is, in effect, turning over your media organization to a vested interest. And finally, over and over again, journalists who are now rushed, I will acknowledge that, failing to independently analyze the quality of the evidence. So if this were a one-slide talk, which as you've seen it isn't, this would be it. Our data shows that we have a preponderance of media messages that exaggerate or emphasize benefits, ignore or minimize potential harms. And we can avoid this avoidable ignorance. We can avoid the avoidable harm that is caused by this pattern. So I use a lot of water analogies. Somebody in Europe used this phrase, infoxication. It doesn't necessarily have anything to do with Fox News, but it's a mashup of information intoxication. We are delivering such a flood of information every day that is not ready for prime time that it's like trying to give a thirsty audience a drink from a fire hose. And it is like a tsunami drowning the public every day. So while we try to improve media messages, this is far more than a journalism initiative. Because going into this, I thought if journalists are thin-skinned, none of us takes criticism very well, I don't, then at least what we're showing in how to critically analyze and improve the critical analysis of journalists also applies to the improvement of critical analysis of the general public. We've recently begun doing, and I just got a small grant to begin doing audio podcasts. And I've interviewed a few of you, and this will be showing up on our site soon. I think it's really important that the public hears the voices, the passion, the commitment directly from people like John, who's one of my interviewees, and not just see words in print. And I do a lot of media interviews as well to try to convey these messages and our findings. I'm not bragging about this international travel. I frankly am really tired of it. But I do this because wherever we go, and especially on these international trips, many of these are in conjunction with the National Cancer Institute that has done a series of international health journalism workshops that I've helped them with. Wherever we go, people say, how can we create a health news review in our country? And I can't help them much. It's a daunting enough task in our country, but we do try to inspire. So some specific actionable items for you. First of all, the simple one. Don't ever complain about, don't ever read, watch, or hear a flawed media message about healthcare without doing something about it, without writing to the reporter, without writing to a news editor, without asking, if not you, someone in your institution to meet with the editorial board of that news organization. Where do you think many of the op-eds come from that the papers themselves write? It's because somebody cared and met with the editorial board. Join our effort. Join us as an editorial contributor, even as an occasional blogger, even as someone who calls or writes me and says, hey, why don't you do something about it, and you may want to interview such and such, or as a financial contributor. But help spread the word. We are still largely unknown in too many circles. Join me in going on the road to conduct journalism workshops. I'm sure that if some of you did, we'd get more Arnold Foundation funding to do that. And so imagine the combined impact. I just did a workshop for journalists with a medical officer of the Agency for Healthcare Research and Quality who serves the U.S. Preventive Services Task Force just on screening issues. So I covered the journalism perspective, she covered the science perspective. What if we did this across the country, taking the mountain to Muhammad, going to newsrooms, and having both the journalism and science perspective? And then finally, most of you are in institutions that generate news releases, and let's clean those up. Let's make sure, take a look at our 10 criteria and see how your institutional releases match up to our now 10-year time-honored criteria. So thanks for including us, and I do look forward to having further exchanges with many of you in the future. Thank you.